Assalamu alaikum. Today I will talk about branches of ascending aorta. Before that, I have to talk about what is aorta and what are the parts of aorta. For this reason, let's draw a heart at first. It is the heart as far as we know them. The heart has four chambers: the right atrium, left atrium, right ventricle, and left ventricle. From left ventricle arises a great arterial trunk. This is the aorta, and it is a type of elastic artery. Now, what are the parts of aorta? The parts which arise from left ventricle up to this mark, covered by pericardium, it is called ascending aorta. And the part which arch over the heart called arch of aorta, and this is the arch of aorta. Now, the arch of aorta descends behind the heart up to the lower part of abdomen. Now, the part which descends behind the heart is called descending aorta. Again, the descending aorta divided into two parts according to its position or descending side. Like the descending part which remains in the thorax called descending thoracic aorta. If it is the diaphragm, then up to the diaphragm remain in the thorax, it is called descending thoracic aorta. And the part which pass through the abdomen, this is called abdominal aorta. Now, what are the branches of ascending aorta? There are only two branches of ascending aorta: the right coronary artery and the left coronary artery, which supply the heart and gives several branches. I will talk about it in the next video. From where the right coronary arises and from where the left coronary artery arises. At the root, there are three sinuses. And what are the sinuses? First, I have to draw the sinuses. Suppose it is the inner wall of aorta. And there were three bag-like structures. Within the bag-like structure, these are called sinus. The name of the sinuses are, if it is anterior, then it is left posterior, and it is the right posterior. And these are the opening of coronary artery. The right coronary artery arises from right posterior aortic sinus, it means from here, and the left coronary artery arises from left posterior aortic sinus according to the Gray's anatomy. But according to the BD-Chaurasia, the right coronary artery arises from anterior aortic sinus and the left coronary artery arises from left posterior aortic sinus.